Hi, this is Wendy with the DME Consultant. With so many changes in the healthcare industry, physicians and urgent care facilities are looking for ancillary services to build revenue, improve clinical outcomes, and to increase patient satisfaction. For many doctors, adding durable medical equipment, otherwise known as DME, to their practice offers an exciting and very profitable opportunity. Durable medical equipment is a class of Medicare-approved equipment that patients use for daily living and is authorized by an enrollee's physician. The opportunities within this segment of the healthcare industry are growing rapidly. Consumer spending within the durable medical equipment industry continues to increase, with projections reaching over $70 billion in spending by 2025 for DME products and services in the U.S. alone. Yet, there is a continuing misconception about whether doctors can provide DME services to their patients, especially due to the very complicated wording of the Stark Law and the Medicare supplier standards. Most doctors are still under the impression that they cannot provide their patients with prescribed products, but that is simply not true. The Stark Law reads, "There are few, if any, situations in which a referring physician would personally furnish DME supplies to a patient, because doing so would require the physician himself or herself be enrolled in Medicare as a DME supplier and personally perform all the duties of a supplier set forth in the supplier standards." Sounds like that would be nearly impossible, right? Wrong. Those standards are the very same standards that apply to the corner mom and pop DME supplier, every other DME store that you see. Most physicians that I know are completely capable of maintaining those standards and then some, especially if they're already a Medicare provider for services. But to be very clear, you must be separately enrolled as a Medicare DME provider, which requires a separate PTAN number. Also, you would still need to show proof of compliance, proper licensing and documentation, as well as acquire that DME supplier PTAN number to be able to bill Medicare. Acquiring this number can be challenging, as is much of the documentation for Medicare. So it is wise to use someone experienced in the application process. As soon as a physician becomes a Medicare DME provider and meets all of the supplier standards, they can supply the prescribed products to their own patients only. They no longer have to outsource the DME products and are able to add that revenue to their own pockets. In addition, it is highly expected that competitive bidding will be back in place in 2021. And the physician who has become a DME supplier will not be affected and can continue to supply their own patients with their prescribed products. The DME Consultant guides doctors and entrepreneurs through the entire process of becoming a Medicare DME provider. We are paid only after you acquire your PTAN number. So do yourself a favor. Call us today.